Welcome to another edition of Quarantine Corner with Amber Integrated. Today, I am happy to have Carter Kimble, who is Governor Stitt's Deputy Health Secretary, joining us from his palatial estate, where he is, as he's advised everybody else, sheltering in place. But we do notice that you still have your Christmas lights up. Is it?
Yeah, of course.
Do you think it's possible that you might use this opportunity to take them down, or is that?
I thought that among some other things would become a possibility and have been proved wrong. So no, I think they're going to stay up, and frankly, we could use a little Christmas cheer, if you will. So no, they're going to stay up for sure. They were on the list to come down, and now they're up for good.
Well, now this helps me out with my mom, because when we were kids and we had Christmas lights, I just told her, let's just keep them up year round. What's the point? You just got to put them right back up. So,
you got to put them right back up.
Yeah, exactly.
So, I try the same logic on making the bed with the missus, and
doesn't work.
It doesn't work.
Yeah, well, it's worth a shot.
It was.
Well, thanks for joining us. I know that you are incredibly busy, and for those out there that may not be familiar with you or your roles and responsibilities and a little bit of your background, maybe briefly touch on that.
Sure. So my educational background is master's in public health policy and administration. Before that, I did some public relations for a couple different nonprofits before graduate school in the Dallas-Fort Worth area. Came up to Oklahoma. My first job in Oklahoma was with the Oklahoma Healthcare Authority, the state's Medicaid agency, and did that for 6 or 7 years, went to the state's health department for a couple of years, and most recently, before coming to the governor's office, was with Oklahoma State University, helping their medical school and their hospital with some different policy endeavors. And so kind of been around different sides of healthcare for a little bit more than a decade now in the state, and then was brought on to Governor Stitt's team last June. So what are we, 9 months now?
Yeah.
So been doing that. It has been incredibly fast-paced even before COVID, and really exciting, really good opportunity for me and some other stuff, but happy to be here and join you for hopefully a worthwhile conversation.
Oh, great. Well, tell us a little bit about what it's like, in the governor's office right now.
Yeah.
I mean, you are clearly on the front lines of this battle. I checked today. It looks like we're over 2,200 confirmed cases,
Yep.
I think 123 deaths. A lot of people have, kind of compared this to, being at war or something along those lines. What's it like to be kind of at the eye of the storm?
Well, I'll tell you, initially, I think just like so many other states and places, we really got into an environment where we didn't quite know the enemy. To carry the war analogy out, we didn't know the enemy. We were trying to identify what resources we had, and the same on the federal government front, just around supplies and things like that. And then it came into a model of predicting, right? Trying to figure out, okay, how does this enemy move, and what are its kind of weak points? And its weakest point is how you get to things like social distancing. It is a very effective disease at getting from one person to another if folks are proximate, if they're close to each other. And so, I would say after probably a week period or so, maybe 10 days, once we got some kind of formal command structures in place and things like that within the governor's office, it was still so fast paced, but you at least had this new normal of what was this cadence. 80, 100-hour work weeks are now kind of part of the norm. That has slowed down a little bit as we've gotten our hands around some different things. And also the inclusion of the Oklahoma National Guard just in support and logistics, to really some manpower in terms of research and reporting, kind of tracking down different things, helping with some of our supply chain stuff on personal protective equipment and stuff like that. So I wouldn't say the activity has slowed down. We've just gotten better at it. And so now it's not as kind of crazy, intense, fast-paced as it was, say, 3 weeks ago. But it's still very much a all hands on deck. The governor's staff is not enormous, but everybody is working on COVID right now. So, as an example, the person who has a policy portfolio of agriculture, well, they're not working on agriculture right now. They're working on COVID-19 and the state's response. So it is kind of that all hands on deck, and I think we're in a good place now from staff and resources and things like that. But it is still very intense, all kind of centered around an activity that has come together in the last couple of weeks. That is a daily briefing for the governor, where we get deep into numbers. We hit kind of important policy decisions. That's where a lot of the planning and phasing occurs. And so that's kind of the cadence. And once we got into that rhythm, you really have this placeholder, 4 or 5 o'clock every day. There's a briefing for the governor, and everybody's got to have kind of their assigned duty for that taken care of. And so it's been good. I think we've done a whole lot of really good work, and still have yet more to do. We still don't know a lot about this disease and things like that. So it's good, but it's definitely fast paced.
Where do you think, I mean, a lot of us have heard the media talk about flattening the curve and all of this type of stuff. Where do you think we are relative to COVID right now? What do you think we are as far as how do we come out of this? And then I think a follow-up question to that is going to be, what is there a new normal? Have we changed what the new normal is?
Yeah, I think that's honestly, it's the $1 billion question, or the multi-trillion-dollar question if you're the federal government. And it really is still being able to hotspot and track cases and things like that. So there's still potential for outbreaks and things like that. But zoom into Oklahoma, we are under where we thought we were going to be. I mentioned before, getting into a regular cadence, one of the things that occurs at that briefing is we take a look at epidemiological models that kind of say, hey, this is the best that we can predict. 3 weeks ago, where we thought we would be today, we are well under that. So in terms of flattening the curve, if you will, I think a lot of the things that have been done are the right things. Kind of credit to the Oklahoma citizenry for taking the social distancing seriously, for employers encouraging folks to work at home and stuff like that. That is definitely flatten the curve. I don't believe that we have necessarily hit our peak yet. It's kind of once you start to flatten a curve, it makes sense that it's harder then to identify what a peak looks like, because it's relatively flat. So you want to see, regressions and things like that have consistent downward momentum. We're pretty flat, but we're not downward. And so I don't think we've hit our peak yet. And there's always...
you think we're plateauing a little bit at the top?
I think that's right. I think there's always the opportunity that we can get lax with social distancing and stuff like that. The disease is still very present, right, in the state. And so if we get lax on social distancing, or if we reopen things too quickly, then I think you could see something kind of spike, if you will. But no, I think for the most part, we're pretty comfortably plateauing, and that also implies we have just as much upward movement as we do downward. So there's still new cases and new opportunities. A lot of that was getting our hands around testing and being able to test a whole lot more. Obviously, nationally, we've had supply chain problems and some distribution issues with testing. So much of that is now kind of an artifact, a thing of the past. Now it's, once we have that sample, can we get it processed quickly? And we can now To your question about the new normal, I think one of the things that we're going to have to be really thoughtful about, especially with policymakers and decision makers going forward, is when we come out of this, what are the things that we're going to start putting in place? A lot of it start at one end of the spectrum. You can talk about built environments, right? We may have to take a look at how people are queued at the grocery store or things like that. I'm sure a lot of us have seen the X marks on the floor or whatever. That is this distancing. I think some of that stays around actually in kind of the new normal. And I think some of it probably shows up in the form of government intervention, if you will, regulatory steps to be taken to make sure that we ease back into it. But I think the rest of it is also going to be the market. I think of the, business decision makers are going to have some tough steps on their coming up just because of what their business is or isn't. All of a sudden, it may scare people away if your business is kind of predicated on people being crammed into small spaces and things like that. So I think it's something that we have to be thoughtful about. How do we think about it? And then I think you start seeing, who knows how long it lasts, but a lot more of the kind of readily available hand hygiene stuff. I mean, you're going to see hand sanitizer dispensers everywhere. And Purell is go buy Purell right now. I'm bearish on them, bullish on them.
Well, so and it seems like the citizenry, as you talked about, they've learned a lot through this as well. So, a lot of the things that citizenry have learned about germs and how to keep your distances, hopefully a lot of that will stay in place too.
Yeah, I think that's right. And, the other thing, we still have a whole lot to learn about COVID. I think that, part of the scary part of this particular disease is there's no treatment and there's no real kind of chemical prevention. There's no vaccine or prophylactic that we're aware of. So a lot of those things, as far as medication or prevention interventions, a lot of those are going to be fleshed out. The other thing that's super interesting about how we enter back into a new normal is just the concept. We don't know how immunity on this looks. The only real scientific studies that are out there that are even yet to be peer reviewed kind of points to people who have had COVID and they're on the other side of it. They have had different antibody responses. So effectively, if you and I both had COVID and we get past it, there's no standard at the end of it for what the expectation of antibodies present would be to keep me or you immune. You could have had a lot higher response and I could have had a lot lower, and thus I'm still vulnerable, but you could be immune. So that's kind of the, how do we look at this? A lot of people have pointed back to the, 1919 Spanish flu and its hook, right? It had a couple of waves that kind of cropped back up. And so we've got to think about that too and be smart about what that new normal looks like.
You talked about your daily routines and all of the stuff.
Sorry, that's my dog. It's okay. Everything's fine.
that happens. You talk about the daily briefings that happen in the governor's office, and I know that the governor's a businessman, and I know he's got a lot of people advising him, and one of his main priorities has been economic development, jobs, all those type of things. How is he weighing the economic health versus the physical health of Oklahomans during this, and how's he balancing that?
Yeah, that's been a really tricky one because I think a lot of times you get into different frames of conversations and how you look at that. Look, I'll be the last person who would say something like economic health isn't a contributor to physical health. It absolutely is. The ability for somebody to be fulfilled in their day and be able to provide for their family, that's physical health, and not just physical but mental health as well. You worry a lot about substance use and depression, anxiety, some of those things flaring back up kind of in this environment. So they're not as separate as people might think. And I think the governor has people around him who kind of remind him of that physical health can be an economic factor as well, right? If you've got a populace who businesses are still open, but everybody's sick, is business actually open? No, not really. So I think that as he has weighed those decisions, it's been really tough. It's been really tough for him to balance some of those things. And I think that was evidenced by some of the rollout that was a more tempered approach than what we've seen in some other states and across the country, where it was at first, initially counties that had cases. A lot of it that you've got to remember is that Oklahoma City and Tulsa, their local governments went a step further early on. And so really it was on us for kind of the rest of the populace to figure out what was appropriate and things like that. But it was, we knew all along we're never going to be able to avoid pretty catastrophic economic fallout. And I think that's what we've seen. We've seen massive unemployment claims and things like that. Some of that is the federal government making some moves on what unemployment looks like and who's eligible and things like that. So it's definitely weighed heavy on his decision making. But he's got a lot of different voices around him, kind of keeping that even keel and temper to the conversation and what a final decision looks like. We have not made any rash decisions, and I think that's a good way to be in a time of crisis.
You have situations like this a lot of time magnify already some of the existing problems that you have in the healthcare system. Whether
Sure.
it's people of color or low-income individuals getting sicker or dying at a higher rate, or rural healthcare, rural hospitals, access issues, a lot of those type of things. Do you think that a lot of this will lead to some permanent policy changes having to do with those issues? I know these are issues that you've talked about, the governor's talked about before. Do you think any of this sheds some light on that, of how we need to maybe jumpstart some of that?
Yeah, I hope so. I really hope so. I think that a lot of it is infrastructure. This is true on the federal level as it is the state level. We've neglected some of the, it's not sexy, but some of the capabilities, our emergency response network, our systems and our technology, specific to our state health department, are old. They're old and antiquated. I think there's a lot of systems changes there that need to take place. And it's just investment, right? It's investment in the state and it's time. This has really shed a light on some of the lack of that. So, on the federal side, I think a lot of it is being able to have contact tracing resources, right? Contact tracing is effectively the premise of, hey, you identify a case, and then who have they had contact with? You trace that out in these communicable disease settings, and it's been around forever and ever. This is not new with COVID. You can think of TB or something like that, where we've had structures like that. As a country, we were caught flat-footed a little bit on our ability to ramp that up. Testing is another one. Our lab capabilities really need to be looked at and addressed. Maybe not technology on that front as much, but just streamlining some processes and having some the ability to kind of quickly respond to different things. Testing was a big frustration for us for a long time. So a lot of those infrastructural type things, I think, stay in place. The other interesting piece is that as we have kind of slowed down just movement and the activity of individuals and stuff like that, how is it that we are able to respond in the light of take elective procedures as an example within the healthcare community, right? We haven't been able to do elective procedures for a couple of weeks now. And I think being able to see the impacts that it has, both from the provider side of the economic revenue hit, and then on the patient side to see, what impacts that has down the road of what we consider elective or non-essential procedures. specifically to income and kind of racial breakdowns, we are watching those figures in the state, and we have not seen a disparate prevalence. We haven't seen the disease hit different racial and ethnic groups. It kind of reflects the general population of Oklahoma. We've had a little bit harder time tracking income level data to see if it's higher or lower income. Generally with communicable diseases and stuff like this, you see it hit lower income groups. But I think they're a multi-factor for why that is. And so there are, of course, things that we need to respond to. And lastly, on, major policy issues of what we adopt, I talked a little bit before about funding and infrastructure, making some investments. I think the structure of how we do things, the governor had already put out in the State of the State this year a desire to consolidate some health agencies. For me, being on the inside, trying to look at this and maneuver and execute on some things in this response, I've got a laundry list of things right now where I'm thinking, man, this response would have been quicker, more efficient, and to individual Oklahomans, to the citizenry, in a better fashion, if a lot of these agencies were kind of housed within one leadership structure. Ultimately, a lot of them now respond to the governor, and so it is that structure. But even then, maneuvering in between the agencies is still a trick, and just trying to bring those functions together, I think, pays massive dividends.
And then add on top of that, you're having to coordinate with the federal government through all
Sure.
of this. What's that been like?
Yeah, it's been pretty interesting. We, a lot of what we experience is different entities that are from the federal side that are putting out different dollars. And so tracking that kind of maze of where dollars and resources come from, you think about National Guard, you think about its resources, the FEMA, so the Federal Emergency Management Administration. You think about Health and Human Services, which has a myriad of different kind of health agencies under it, Medicare and Medicaid, and HRSA, which funds federally qualified health centers and a lot of telehealth activity. So there are a lot of different places. And then Congress has stepped in a big way with, the last stimulus package. A lot of people don't realize that was the third stimulus package. It was the biggest, $2.2 trillion. But Small Business Administration has been, crucial in its role. Department of the Treasury. So a lot of those are putting dollars out from the federal side, and from the state's perspective, there is not a single kind of point of entry to different authority or dollars. So it's been a trick. It's been a trick for us, for sure, to be able to navigate some of that. And we've got a lot left to do. There's a lot of dollars that are allocated for Oklahoma that have yet to kind of hit the state.
Sure. Well, just kind of an extension of that.
Sure.
Providers in this state, obviously, doctors, hospitals, nursing homes, to name a few, rely on Medicaid funding, taking care of Medicaid recipients. A lot of those. So a lot of the providers that are on the front line here fighting COVID have obviously had incredibly increased costs associated with it, whether it's trying to find PPE and having to pay far more, or I've certainly talked to providers who talk about having to incentivize employees to come to work,
Sure.
put their lives at risk, which means they're having to pay a lot more than they normally would, justifiably. So some of that money that the federal government has put into 3 different packages, do you see that trickling down to some of these providers in a little bit of relief, or how do you think about it?
Yeah, absolutely. I think, another layer onto, okay, where does the federal money get allocated from? Once we have it in the state, we have the same trick. We want to make it easier on Oklahomans, whether it's individual citizens, businesses, healthcare providers, or vendors that we're purchasing goods and supplies from. We want to make it easy on them as much as we can in order to interact with the state, and for us to be able to get those dollars kind of in and out of our hands as fast as we can. And so having said that, healthcare providers and really small businesses are the ones that are at the top of the list for us, and being able to make sure that we can get some relief to them. A lot of times, those are the same thing, right? Small businesses are healthcare providers, right? You've got physician offices or long-term care facilities, or even vendors and suppliers. They're small businesses. They hire 50, or they have 50 people, and they're struggling to make payroll and things like that, just like everybody else. So we absolutely are looking to get some of that federal money in, and then how it gets pushed back out. We really have, I think, what'll be a twofold approach. We haven't made final decisions, and so this may be a little bit premature, but I think what you'll see a lot of is the same approach that the federal government took, which was to get initial dollars out quickly, and then figure out where gaps still exist and try and fill those gaps the rest of the way. So I think initially you'll see larger apportionments kind of get out the door as fast as we can to mitigate damage and risk, things like that. Because to your point, a lot of it really is what can healthcare providers, what can they actually do or not do with the resources that they have. So we understand the capital's tight and there's a squeeze on cash and things like that. So we want to get that out the door first, and then go back and kind of reassess where some of the gaps may be with some of the other federal funds.
If I'd have told you 2 months ago that Medicaid expansion would possibly not be the biggest issue that you are, we probably would have had a big chuckle at that point in time. But
I would have.
Prior to this outbreak, Oklahoma was full guns ablazing on governor's plan, Medicaid expansion, all of that type of stuff. Is it safe to say that stuff is on hold, or have you been doing a dual track here and still continuing to work on that?
No, I think it's interesting because the way that the timing of this plan had kind of folded out, the state's development of the program has been done for a little bit. Now, we still have to refine and refine and refine and refine. We still are going in a process of taking public comment on certain proposals, incorporating that public comment into what our final product looks like. I think the biggest thing now, or hurdle, if you will, the fact of the matter hasn't changed. Coming into COVID, we were second worst in the nation in the rate of uninsured Oklahomans or citizens. That's not an acceptable ranking for the governor, who obviously strives for top 10 in everything. We were 49th. And so I think he recognized, look, this is the right thing to do. I want to do it in a responsible way. And so thus you see this kind of effort on him to go and provide an alternative to State Question 802. I think the biggest hurdle now that exists with COVID is less or so the strain that the COVID response has put on a dollar claim, and more so the impacts that COVID will have on unemployment. Obviously from a state revenue side, and then from the side of, if you're unemployed in a Medicaid expansion environment, you are then eligible to come onto the state's Medicaid program as a childless adult. As we sit today, that's not the case. And so now I could make a strong case that Medicaid expansion is needed now more than ever in order for us to be able to respond to something like this. The trick now is, do we think that the dollars are going to be there in the format that we had before? Obviously, we were leaning heavily on a hospital provider assessment to be able to fund a lot of expansion. I think that's still the case. We're having a really good conversation with the hospitals, but we also recognize that they're in a bit of a cash crunch right now with COVID. So whether or not we can make numbers work, whether or not the legislature is willing to kind of go down that road with us on a budget, I think that's kind of to be determined. From the governor's perspective, we are still all systems go. We have not paused or slowed down any of the progress or protocols. we're still going, and I think that's the right approach.
Is the goal still a July 1st expansion?
The goal is still July 1, 2020. I think that we recognize some of the things that occurred in the federal stimulus packages makes that goal very ambitious as far as budgeting and things like that. But I think we are comfortable with our ability to responsibly fund it and start getting people eligible to enroll this summer.
Good. Well, one final question for you. We've appreciated you taking a time out of your busy schedule today, and this is probably one of the most important questions. We've got Thunder fans, we've got sports fans, all of that stuff. I know you and I are both big baseball fans. So the question is will the Thunder get to continue their season? When will Major League Baseball start? And are we going to start football season on time?
So the trifecta of doom, right? This is where the politically savvy part of me says, the classic disclaimer of, I do not speak for the governor. I speak on behalf of someone who pretends to be informed for their day job. So this is in no way an official position, but I would say that in order, the Thunder do not finish the season. Baseball, let's put it this way. Come July 1, my Texas Rangers will be tied for first place in Major League Baseball with a 0-0 record. And college football, that's the center, that's the epicenter of the new norm. I think we will have a college football season. I'm not sure how it looks. The premise, a epidemiologist looking at college football is cringing. Putting 110,000 people on top of each other in a football stadium is not exactly the best way to control an outbreak of disease. But that's to say, will games be played? 100%. I think games will be played for sure. It'll be interesting to see what those games look like.
And I did say it was a final question, but I did want to ask this because we've heard a lot of conversation about warmer weather and all of that might provide relief. Is there any consensus on that today?
There's not really consensus on it, but the premise really being that, the disease has to have it has to have something carry it. The vast majority of times it's mucus or saliva. But those droplets, they don't exist or transmit as well in really hot temperature. And so at which point I think the kind of basic science premise is that may help. But that does not combat if I'm sick and I cough on you and you then rub your eyes, it could be 140 degrees outside and that still is a pathway for transmission. So I think that, how we get into the season will be interesting. I think the other thing that the state in particular, our state has working for it, we're very spread out, right? There's not a whole lot of pockets where people are just living on top of each other, like you would see in a New York or a LA or Seattle or something like that. And so that's the other thing, that the seasonal help, the fact that, people are going to be getting outside and things like that. I think that we're in good shape, especially for the later summer months.
Great.
Yep.
Well, Carter, we appreciate you joining us today, taking time out of your schedule for another edition of Quarantine Corner. Thanks for joining us, and we'd love to have you back anytime.
You bet. We'll do it sometime.
Thank you.